Chapter 13, Sexual Problems in Therapy. Let's get it out there. We all have problems. When hearing the word sexual problem or sexual dysfunction, many people think they would never have one, or at least that's what they say out loud. Many people who admit to having a sexual problem only admit it to close friends, and then because they think they failed somehow or think their partner has failed. If this is true, then over 50% of all couples have failed. In truth, it is more common to have problems than not to. What we need to do is learn what these problems are and how to prevent them from controlling us. What causes problems? Our problems begin because we're all different, a quality we generally admire. Our different expectations, assumptions, level of desire, and preferences often cause problems in our sexual relationships. Men and women, by their very nature, enjoy different stimulation. Before you start thinking of changing your sexual orientation to make things easier, recall that all men and women are not the same either. What works for one individual may turn another off. And we change over time just to confuse things more. It's important to realize that whatever the difference may be, the problem is not one individual's. It's the couple's problem, and no blame should be placed. Sexual therapy. Many people feel that going to a therapist is a sign of failure. Many others feel that sexual relations should not be discussed outside of the bedroom, and certainly not with a stranger. Many of you have voiced these questions about the questions in this course. Try to remember what intercourse means. Communication. That's what a sex therapist does. Helps two people to communicate. Sexual therapy is designed to make a person feel more comfortable with their sexuality and comfortable with the thoughts that are preventing them from fully enjoying sexual communication. A therapist will first rule out any medical condition, which might be causing the dysfunction, and look at the sexual history of the partner to determine underlying factors which might prevent enjoyment. Many then follow the implicit model, as you can see in your book, to discuss and desensitize the couple and allow for self awareness and desensitizing the individual to the factors causing anxiety, leading to exercises designed to help the partners become more aware of one another. The sex therapist will not have sex with you. They will help you with your problems. If they suggest having sex with you, move on. What problems can happen for all sexes? Sexual problems can affect both men and women, and some are partially specific to each sex. Some of these problems could be due to medical conditions, which is why this should be ruled out before any therapy. After that is ruled out, we focus on psychological factors and relationship problems. Both sexes can suffer from hypoactive sexual desire and sexual aversion, a lack of sexual desire or fear of sexual behavior. This could be a problem for an individual's entire life, which is called primary, or could stem from a later trauma in life, which is called secondary. This is considered to be the most difficult problem to treat, but it should not prevent people from trying. In fact, it's actually one of the most common reasons people go for therapy. On the flip side, we have hypersexuality. This condition is hard to define since how much sex is too much sex. One person could consider someone to be hypersexual, while another could consider them to be perfect. We consider this a disorder when the person becomes addicted to sex and gains compulsiveness over sex. When additional sexual experiences do not add to the person's happiness, and they leave each experience feeling like they've gained less from it. Usually the person is trying to fulfill another need like love or intimacy with each additional sexual experience. This can be treated by helping the person realize and fulfill the need that is missing in their life. Both sexes also suffer from dyspareunia or painful intercourse. Often this is caused by physical problems, but if the physical problems are not swiftly fixed, this can lead to individual and then to avoid sexual intercourse for fear of experiencing pain. Other psychological causes like discomfort or social upbringing can cause a person to experience pain. If the individual is feeling guilty about sex, they may feel pain, or a woman may not allow herself to become excited and therefore have no vaginal lubrication, causing pain. There's a lot of terms used. For the remainder of this dysfunctions, we'll look at, they'll be separated into male and female disorders. In truth, many of them have similar causes. We all know that male erections and feeble lubrication are the same response, different reaction, but we look at them individually. All of the dysfunctions might be separated into primary or secondary and global or situational. Primary, always been a problem. Secondary, develops later in life, global in all situations, and situational in specific situations. For men only, male erectile dysfunction, or which is once called impotence, we no longer use that term because it implies that a man is incapable of doing anything if he can't do this one thing. This is obviously false. He is simply having difficulty in one area. Most men will experience this problem at one time in their life, whether due to alcohol, drugs, fatigue, or stress. It's not a sign of failure or a problem. It is considered so when it seriously impairs the individual. Some causes are medical and can be treated with medicines, pumps, implants. None are ideal, but they're better than nothing at all. In other cases, the problem is psychological. An easy test to see if it's psychological or physical is the peek under the sheets test. While he's sleeping, peek. Try this a few times. If you see an erection while he's sleeping, the problem's psychological. Again, primary disorders are more difficult to cure and often the result of upbringing, and the cause of the problem must be recognized and rectified with the individual. With secondary erectile dysfunction, the most common cause is performance anxiety or fear of failure. If a man feels pressured to gain and maintain an erection, the pressure can cause this not to work. And one failure can cause another failure, which can cause another failure, or what we call the snowball effect. Each failure causes more anxiety, which leads to additional failures. This may be cured through therapy designed to reduce the need to achieve and experiencing or emphasizing pleasure without erection. There also is, of course, that magic blue pill. We'll discuss that later. The most common male sexual problem is premature ejaculation. Much of this is a result of training. The majority of males' first sexual experience is masturbation, which tend to take only a few minutes. Women take far longer. You do the math, but the outcome's the same. Realize that while some men may be quicker than they wish, we only consider it a problem when it causes the man to experience high levels of distress. Either way, simple exercises like the squeeze technique and stop-start technique can often help alleviate the problem. Some men suffer from the opposite problem of male orgasmic disorder. Often this stems from a fear of ejaculating into a woman's vagina as a result of upbringing or a trauma. This may be overcome by realization of the basis of the fear, like pregnancy, and training techniques to reduce the anxiety. And finally, two conditions which can be primarily associated with medical conditions: benign coital cephalgia, or headaches after orgasm, and priapism, or a long-lasting erection, both of which may be treated medically. For women only, vaginismus is the term given to the female disorder of painful intercourse with a psychological cause. This is primarily the result of a strict upbringing which forbade sexual behavior and or enjoyment, or a trauma later in life. As a result, the woman experiences involuntary contractions of her pelvic muscles, which prevent her and her partner from enjoying sexual intercourse. This can be relieved through relaxation exercises and dilators to expand the vagina. Women also suffer from female orgasmic disorder, but unlike men, this is sadly not common, or sadly not uncommon. Like the use of the word impotence, we no longer use the word frigid since it implies the woman is cold and insensitive, when in truth she is not. One of the primary problems is that women need more time and stimulation to achieve orgasm than men, and partners don't always recognize this. Also remember that women experience different types of orgasm, and the majority of women achieve this through clitoral stimulation. The upper two-thirds of the vagina has very little nerve endings, so if that's what's being stimulated, it's no surprise that women don't achieve orgasm. Many people also feel that stimulating the clitoris while having intercourse is cheating. I despise cheating. I would never recommend cheating. This is why I will still recommend stimulating the clitoris. It is not cheating, and it works. Another good option is the woman on top position, which often stimulates the clitoris and frees up the man's hands for additional stimulation. Other factors which may contribute to this condition are negative attitudes about sex. As we've learned, many people have been taught and are still taught that women should not enjoy sex, and sexual suppression of women. Many other women have a difficult time letting go, and women can suffer from performance anxiety just like men. So how do we avoid problems altogether? The best way to avoid all of these problems or to overcome them is to feel good about your own sexuality and to learn your own partner's needs through, yes, communication. And don't fake it. If you do, don't complain to me when your partner keeps doing the wrong things to turn you on, because you're the one who told them you liked it by faking. And don't treat sex like the sexual Olympics. No one will be hopping up at the end of your bed with big scorecards telling you how well you did or to give you an extra points for the second or third orgasm. If something doesn't go right the first time, that just gives you more incentives to go back and do it better the second time. And if you don't, who cares? We have problems when we become too focused on the goal. Stop that and enjoy the moment. As long as you enjoy and love one another, that is what matters.